Hi, good afternoon. So today we will speak about clavicle fractures, which simply means a fracture involving the collarbone. As we can see that the collarbones are rather superficial, they are very easily palpable, and often if you have a fracture involving the collarbone, you will be able to notice a deformity. There will be marked swelling and tenderness. And of course, when you attempt to range the shoulder, it will be extremely painful. So why do clavicle fractures occur in the first place? Most of the time it is due to a significant trauma. Often after falling down on the shoulder or trying to break a fall on an outstretched hand, as a result of the forces being dissipated to the upper arm, the clavicle often fails and it breaks. Now, to diagnose a fracture, you would require an X-ray, and typically the X-ray will determine the exact site of the fracture and the degree of displacement of the fracture. Most of the time, these fractures are in isolation, and typically if the displacement is less than 2 centimeters, then it is often treated conservatively. You will be given an arm sling to rest your shoulder with some anti-inflammatory medications. You can also ice the area to help the swelling to settle, and over a couple of weeks you will find that the pain is less and you can start gentle shoulder mobilization. Typically the healing would take at least between 6 to 12 weeks. However, if the fracture fragments are comminuted, they are displaced more than 2 centimeters, or there is significant overlapping, or if there are injuries which are associated with acromioclavicular joint dislocation or any other associated shoulder injuries, then a surgical alternative may be an option to be considered. Typically, if the fracture fragments are very widely apart, then healing can be an issue, and therefore the doctor may recommend early surgical intervention to restore the fracture fragments so that you can start early mobilization. At the same time, you could help in the healing in the most ideal anatomical position. Therefore, whenever there is an injury to the shoulder region, and if you have pain near the clavicle, get an early diagnosis, get an X-ray, and based on the X-ray findings, you will be explained in detail regarding the treatment options. Thank you. Take care.